Hello, my name is Lance French. I'm a student nurse, and this is my video showing a return demonstration for the intradermal injection procedure. Firstly, I will need to gather my materials, which are a pair of clean gloves, at least 2 alcohol pads, a tuberculin syringe, which has a 27 gauge needle, and the vial of medication, which in this instance is a PPD medication. Now, firstly, I will check for a prescriber's order and check the MAR for this patient. Now that I have that, I will check the vial for any expiration date, any cracks, any particulates in the medication, or any other defects. And while I'm thinking and preparing my things, I'm gonna mix the solution by rolling it between my fingers so that I don't generate any bubbles. So the first thing I'm going to do is clean the vial cap with alcohol. So in the center there, making sure that it dries before I pierce it. Now I'm going to open this syringe. So we have a tuberculin 1 milliliter syringe, 27 gauge needle, and this needle happens to be 0.5 inches long. So that will be just fine for administering this 1 milliliter of PPD medication. So now I'm going to draw in the amount of air that will displace the amount of medication that I will withdraw. So I'm going to I'm withdrawing this PPD solution into the needle. I see that I have some air. I'm going to tap this to displace the air to go up so that I can put it into the vial and withdraw the desired 1 milliliter. And I want to see that that is also submerged in the medication. So that is 1 milliliter. So now I'm going to use the scoop cap method for temporarily recapping this needle. Now I'm going to pull that snug against the hub needle and set it down in a clean place. Now I am going to identify the patient using 2 identifiers. Name and date of birth are good handy things to ask, but you will follow the protocol required by the facility in which you work. And I'm going to explain the procedure and I'm going to explain the medication. So the procedure will be that I will give 1 milliliter of this PPD drug intradermally. So I'm going to place this just under the skin of the anterior aspect of the forearm. And I'm going to check for patient allergies. I'm going to check that I have the right route, the right dose, the right time, and the right medication. So I'm going to check that MAR again and that the prescriber's order is still active. So I'm going to now clean a site for injection. So I found a place that it's going to be easy to recognize in 48 hours for returning. Okay. So I'm going to pick this up, dislodge that from being tight on the hub of the needle. I'm going to pull the skin taut with my non-dominant hand. In my case, that's my left hand. And my right hand, I'm going to hold the needle. I'm inspecting this for where the bevel is, and I'm going to apply this 1/8 of an inch into the skin at a 5 to 15 degree angle. Now that that's placed, I'm going to inject the PPD medication. And I can see the bevel just below the skin. The entire 1 milliliter is injected. Now I'm going to not recap this, but directly place it into the sharps container, which is right next to me. And I can now take a gauze pad and I can cover that where it's going to bleed on the patient and not apply a band-aid. So I'm going to hold that for a moment. Okay, we seem to have stopped clotting. Now I'm going to draw a 1-inch circle around the injection site and explain to the patient that they will need to have this reread by a registered nurse within 48 hours or at 48 hours. And now I will document what happened and what I did in the medication administration record, and also initial, not initial the dose site, but initial, record in the MAR where I injected it, the site on the patient, and make sure that my documentation is complete. And that would conclude an intradermal injection. Thank you.